Hi, my name is Crystal Sarcone. I'm a Master's of Public Health student focusing on global health, and I'm super excited and interested in the possible opportunity to participate in Research Matters as a speaker. I think I would be a great contribution to the lineup just because of my qualitative approach and also the uniqueness of my topic. So I'm hoping to present the topic of adaptive attire. What I mean by adaptive attire is clothing that is designed or modified for easier use for people with disabilities or limitations or people who have non-conventional body types. I particularly focus on amputees, people with severe deformities, or those people that are wheelchair bound. I got my inspiration from my previous work before coming to Brown University. I ran medical trips abroad for about 6 years. I focused on working with nonprofits that provided spine surgical care to children that needed treatment. Usually the patient's diagnoses were around scoliosis or really severe, spine abnormalities. And I started to see these trends when they would come in, right? So a lot of girls that had high neck deformity, many of them had very long hair and they wore their hair to the side, usually on the side of their deformity. Though hair is not a clothing item, it is part of the observations I started to make back then. Many of the boys that had very big humps on their back or, torso deformities wore shirts that were 2 sizes bigger than them to kind of hide that. And so there was kind of a science behind it. Many of the girl patients wore dresses because it was kind of easier to fit one article of clothing to their body than two. And I thought that our patients were using clothing either as a way to hide their deformity or seemed very limited in the clothing that they were wearing. We would come across, a 14-year-old girl that had a type of dwarfism, and she was probably only, 3 feet tall and had to wear children's clothing because that's all that would fit her. And so here we are, we're talking to her and, she's smaller, so we tend to think she's younger, and then she's wearing children's clothing, so we talk to her even more so like she's younger, and sometimes it took looking at their medical chart to realize that, wow, this girl is 14 or 15 years old, I should be treating her like one. And I just thought, man, it would really suck if I, had a condition that kind of limited how I presented myself to the world. And so out of this anecdotal observations, I was wondering if there was any backing to it. And so I started working on a qualitative research project interviewing amputees to see in what way, clothing or adaptive attire, whether adaptive attire is out there or whether they've had to modify their own clothing, and what kind of frustrations or struggles they've come across with conventional access to conventional stores or to the fashion industry in general. There is a wave to include diversity in terms of body figures in the fashion world. I think it's been, a little shallow, and it needs to kind of be a bigger effort. Last year in Fashion Week in New York, they had people in wheelchairs or amputees in the fashion show. However, none of the clothing was particularly adaptive for people with disabilities or different bodies. So my angle was more looking at how can we move forward and start designing clothing that could be more adaptive, like, wrap dresses tend to be very good for people with severe trunk or torso deformity, and just making smaller modifications, whether it be, elastic armbands or shoes or services like offering, people who have one leg the opportunity to buy just one shoe for their needs. Overall, I'm really looking forward maybe to the opportunity to present as a speaker to kind of bring life to my research. And after listening to previous speakers from last year, I really liked what they had to say in terms of the opportunity and going through the process, kind of allowed them to approach their work in a new way. And I am certainly interested in building my professional repertoire and learning effective, ways of communicating my research ideas. And so that's everything. Thanks.